Mom really appreciates being out here with me, and she really enjoys being out in the country and loves to watch the animals and the babies when they're born in the spring and all that sort of thing. And so she wants to stay here. I'm going to do everything I can to help her stay here.
I don't want to live in assisted living. I have my daughter, and I feel like she needs me like I need her.
Mabel is a very spry 91-and-a-half-year-old, but she does have a history of falls.
The reasons that elderly patients in particular get readmitted to the hospital is not taking their meds, not looking after themselves, and also hazards within the home, like throw rugs, which would cause a fall.
So while we may have done everything possible to provide the best care for the patient, if a patient returns back to the hospital within 30 days with the same diagnosis that they were discharged with, the hospital's reimbursement may be challenged and government ratings as well. I believe that people recover better when they are in their homes with a home care nurse, and we can give them this simple technology and we can prevent rehospitalizations for certain conditions. The telehealth monitoring system is set up in the patient home. The patient is asked to take their weight and their blood pressure and their oxygen level every morning, and then the telestation will ask them a series of questions in terms of how they're feeling, and it is sent through a phone line to a website. So even though a patient may be 200 miles away, we are closely monitoring the patient.
I like the telehealth because I feel like I've got somebody else looking over my shoulder.
To date, we've had over 650 patients on our program, and we've had 26 patients back in the hospital. That's less than the national average, so I would say that's good medicine.
Lifeline is appropriate for Mabel as she's in the home by herself on occasion.
If I should get in trouble of some kind, all I have to do is put my finger on it and it'll call for help.
Mom can reach somebody if she needs to when I'm out working the stock or whatever.
Here I can do what I want to, and when I want to, and if I want to.